Welcome to the Affordable Care Act Made Easy. This short video will give you information on how the law and the new health insurance plans will affect you and your family in 2014 and beyond. I think that for most of you, you'll find that your premiums are lower and you'll have better coverage under the new ACA compliant plans. Be sure to watch all the way to the end. You'll see a specific example of a family of 4 that I think will really surprise you. Health plans based on the Affordable Care Act go into effect on January 1st of 2014. They guarantee acceptance for everyone regardless of health history, mandate 10 essential benefits for all plans, create insurance exchanges to allow people to compare health plans side by side, and provide government subsidies in the form of tax credits to help people pay their insurance premiums. But before we get started, let's make 2 things perfectly clear. First of all, the federal government is not in the health insurance business. Your plans will still be issued by United Healthcare, Blue Cross and Blue Shield, Aetna, Humana, and a host of other health insurance carriers. Second, health insurance is not free. The federal government has committed a lot of resources to make it more affordable, but it's not free unless you qualify for Medicaid. Here is a list of the 10 mandated essential benefits that will be included in all ACA-compliant health plans. Plans from different carriers will vary in how they offer these and what other services they include in a particular package. You can purchase ACA-compliant plans through either public or private exchanges. The public exchanges will be run by the state or federal government. They will be staffed by navigators who have a limited amount of training and cannot, by federal law, advise you on which plans might best fit you or your family. Initially, the public exchanges will have a limited number of options. Many insurance companies, including United Healthcare, Cigna, and Assurant, have decided not to participate in any of the public exchanges in the country in 2014. Those companies will have ACA-compliant plans available, but they will only be sold through private exchanges. And those private exchanges will be staffed by licensed, experienced insurance brokers. By federal law, a private exchange must provide access to all the products available on the public exchange in a given state. Plus, they will have additional options from United Healthcare, Cigna, Assurant, and several others. The subsidies you receive are exactly the same, and the pricing of health plans by federal law is identical. There is never any additional charge to use a private exchange. You simply have more options to choose from and receive advice from a licensed professional. Later in the year, if you have a question or concern about your coverage, you have your own insurance agent to talk with. On the public exchange, there is no such service available. So what is a subsidy anyway? Well, it's a tax credit that is based on your annual adjusted gross income, the number of people to be insured, and the size of your household. Once you've signed up for a specific health plan, starting in December, you'll pay your portion of the first month's premium. Once your payment is received by the insurance company, the federal government will pay your subsidy directly to them. You must make your first payment to the insurance company prior to January 1st, or your insurance will be canceled and you'll be subject to a penalty. So who qualifies for these subsidies? The answer is those with an adjusted gross income between 100 and 400% of the federal poverty level. This chart shows those ranges based on household size. If you don't qualify for a subsidy, there are still very affordable options available. In regards to the plans themselves, there are 4 options available to folks between 30 and 64 years of age. They are called the metallic plans: platinum, gold, silver, and bronze. For those under 30, there will also be a catastrophic option that will be less expensive. For the rest of us, we will need to choose one of the metallic options. For those with pre-existing conditions who tend to go to the doctor more often, we recommend the platinum or gold plans. Under these plans, you will be responsible for 10 to 20% of the costs, and the insurance company will cover the rest until your out-of-pocket maximum is reached. And then the insurance company will pay 100% of everything. These plans will tend to be higher in premiums but will require less cash out of pocket each time you go to the doctor. For healthy people who don't go to the doctor very much, we recommend the silver or bronze plans. These plans will have lower monthly premiums, but you'll pay more of the bill when you go to the doctor's office. So how much should you plan to come out of your pocket in a normal year? For most people, that will depend on the deductible you pick. You'll have a choice of deductibles ranging from $0 to $2,000. In the event of a major health event like a stroke, heart attack, or an accident, the maximum out-of-pocket expense for an individual is $6,350, and that includes deductibles, co-pays, co-insurance, prescriptions, everything. For a family, the maximum is $12,700. So these plans have lowered the maximum liability for many people, But for most folks, it's still a lot of money. And that's not all the story. It is important that whatever money you spend on insurance goes to provide protection against the things that can destroy you financially. And the new healthcare laws don't do that. According to the American Hospital Association, 84% of the time the reason we go to the hospital is because of an accident. 82% of the time the reason we stay in a hospital overnight or longer is one of 4 major health events: accident, heart attack, stroke, or cancer. And when one of those major health events occurs, 2 other bad things happen. Income goes down and expenses go up. Most families are not prepared for a major reduction in their income while their expenses go up several $1,000s in a month. Over 56% of all the bankruptcies in the U.S. are caused by medical bills, and 2/3 of those people had health insurance. If they had health insurance, why are they declaring bankruptcy? The key to that question lies in understanding where most of the financial risk is. The American Cancer Society tells us that over 60% of all of the costs associated with a family member having cancer is in non-medical and indirect medical costs that are not covered by most health insurance plans, including the new ones. If you owned a house, would you ever buy fire insurance that only covered 40% of the house? Well, of course not. But when you only buy health insurance, that's exactly what you're doing with regards to cancer. But how likely are you to get cancer? Well, again, according to the American Cancer Society, 1 in 2 men and 1 in 3 women will develop some form of cancer in their lifetime. What that means is that the probability of cancer touching someone in your immediate family is over 83%. So for most of us, it's not a matter of if, it's only a matter of when and how well prepared we'll be when it happens. But there is an affordable solution. It's called the Total Protection Plan. The Total Protection Plan is a combination of health, critical illness, and accident coverage. A family of 4 with an adjusted gross income of $50,000 can purchase a bronze ACA compliant plan, and their portion of the premium is only $97 a month. They can then add $10,000 in accident coverage and $10,000 in critical illness insurance for the entire family for only $125 a month. In the case of a major health event, they have $10,000 per person to pay deductibles, co-insurance, co-pays, and any uncovered medical expenses. Remember, it's not a matter of if, but only a matter of when someone in your immediate family has a major health event. Don't let that health event destroy your savings, investments, and retirement accounts. For most of you, the Total Protection Plan provides more coverage for less money than you're spending now. So when does all this happen? October 1st of this year through March 31st of 2014 is the initial open enrollment period. To avoid any penalty, you need to sign up for coverage between October 1st and December 15th with a planned effective date of January 1st of 2014. For those of you who think you'll just wait and buy health insurance when you get sick, that won't work. After March 31st of 2014, if you get sick and need help, you are on your own. No health insurance will be available to you until January 1st of the following year. Certain qualifying events allow people to purchase insurance in between April 1st and December 31st of 2014, but getting sick is not one of them. Open enrollment will occur each year between October 15th and December 7th. At that time, you can change your existing plan to a different one if you choose to. For more information, go to www.usabenx.com or contact your USA Benefits Group agent.